Hi, welcome back to my channel. It's Dr. Erica. Please like, share, and subscribe. My main channel is Erica Onigbola Farm D. Please binge watch all of my videos. I am a registered pharmacist licensed practicing since 2013, and I am here today to talk about the month of February being the month of heart health. If you are someone who knows about heart health, then please like, share, subscribe, comment as well. And please binge watch again on all of my videos that I have. I'm a pharmacist. I want to recommend 2 to 3 supplements that are over the counter for heart protection. The first is coenzyme Q10 or co 10 or Q10. I have a bottle here that I can show you what it looks like. This one's 200 milligrams. There may be, if for starters, a great start once a day supplement to help protect the heart. And I want to recommend CoQ10 as well as omega fish oil 369 omega fish oil. Then there's krill oil as well that you could use to help protect your heart, help reduce chances of cholesterol, artery buildup. You want to have healthy heart cells, and then also you want to make sure that your blood pressure is in control, your heart rhythm is in control, your heart rate is in control as well. And then I also want to suggest sodium intake, low sodium intake for those who have kidney issues or heart issues and or have edema issues, fluid retention on the lower extremities. Then very low sodium or no sodium diet will go a long ways. We want to increase our outcomes, decrease hospitalization, mortality risk. Then I also want to suggest for those who have normal organ system functioning to keep your sodium intake at 1.2 to 1.5 grams per day. Again, that's 1.2 to 1.5 grams per day. This will help to keep your sodium intake in proper concentration in the blood levels, helps your organ systems like your kidneys, your liver, your heart itself to not be perfused with sodium or salt or water retention. Because we know, as research has shown us, water will follow sodium. And if we have so much sodium in our system over time, we build weight gain as far as fluid retention, again in our lower extremities, in our kidneys, making it harder for our kidneys to function, making it harder for our ejection fraction of the heart to eject our plasma and our blood to our organ systems. Then I want to suggest exercise 3 to 5 days per week, moderate intense exercise that can be cardio aerobics, that can be water aerobics. It could be a brisk walk, it could be a marathon that you might do occasionally. It could be yard work, it could be um, walk and hiking. It could be something that you like to do that helps to get you sweating. When you're sweating, your body is releasing poisonous items, it's releasing waste that your body does not need. So when you sweat, you're doing your body and your heart a favor. The more you sweat, the better. Also, speak with your physician before you start any new regimen or changes in your nutrition or supplemental regimen. Then you want to speak with your physician first, speak with your nurse staff, speak with your pharmacist to make sure there's no drug interactions at the pharmacy level. And then you want to be sure to take in consideration the risk. Benefits usually outweigh the risk, but again, you want to make sure that you understand the pros and cons of every choice in your health. Now, although I'm talking about physiological heart health, there's also spiritual heart health, there's emotional heart health. What do we think about mental health, external environmental effects on our cardiovascular system, as we know, can detour our system. It can help our system. It just depends on each individual. So, speaking on a spiritual level and emotional level, the more we're emotional, whether it be happy or sad or going through a catastrophic event, could be a family event, someone passes away, or there could be a traumatic event, a domestic event. All of those can play a role on our heart health, increasing our blood pressure, increasing anxiety, increasing the rate at which our heart um, beats per minute. Our heart rhythm can change. Medications can change our heart rhythm. All of those things, emotionally and spiritually, internally, mentally, have an effect on our um, carnal, our flesh. So when our heart deals with stress or anxiety or things that may be not normal on a regular basis, then our heart is going to react. Um, Weather, even the weather, chilly weather, if you go outside in cold weather, your blood vessels are going to change. They're going to help protect your heart because the heart has to be protected. It has to be perfused. It has to stay warm. So your outer extremities are going to have vasoconstriction. So the heart is very vital, is very sensitive. Things happen normally, but once we are protected and we're doing what we're supposed to do on a regular, daily, weekly basis to help facilitate our medications, to help facilitate, stability and prevention, then we have a better chance of decreasing hospitalizations, improving our outcomes. And that's what we want as pharmacists, as healthcare providers. Um, there's a lot of celebrities who have come out in the recent news about their heart condition. You might have heard of Ray J and having a ejection fraction or a ventricle ejection fraction of 25%. Um, He's I mean, that's catastrophic. That is catastrophic numbers. We don't That's not someone who should even be alive with those numbers. We are concerned at 40% ejection fraction. So when you're dealing with stressful events, seek a therapist. When you're dealing with events that um, may be out of the norm, talk with a elder, talk with a counselor, talk with a pastor or someone who can hold you accountable and willing to, a spouse, even someone that you can confide in, that you can trust, and who knows who you are and can relate to what you're going through. So other things that can cause heart stress, heart attack, heart infarction can be illicit drug use. It could be use of crack cocaine. It could be uh, over time use of methamphetamine products, um, things that are harmful to the body, such as those items, can eventually cause death. I also want to recommend use of minerals and medications that help the kidneys, medications that could interfere with the kidney production, ultimately can interfere with the heart production. Antipsychotic medications, for example, apple cider vinegar use, for example, can affect the electrolyte percentage in the body. And once that is out of control, then that could eventually cause some problems with the heart. Also, be aware of your what you put in your body, what information you take in, um, who you interact with on a daily basis. because emotional change, again, mental changes can affect your outer appearance, which is your heart control. You don't want to have to deal with your heart. Is fragile, it's vital, and again, what you put in is what you get out. Bone health can affect your heart as well, your teeth, cleaning your teeth, personal hygiene, oral hygiene can affect your heart because the gum lining, all of those are connected to blood vessels. Also, your internal bones. Bone health um, is a like a first or secondary organ system that affects the heart because the bone produces blood cells. So if you're dealing with fragile bone or if you're dealing with bone disease, blood production disease, then that can eventually have an effect, adverse effect on the heart cells, the heart production. So be aware that bone strengthening is very important as well. If you're able to do weight bearing exercises, that means utilize weights to help keep your bones strong. You help your bones by getting a bone mineral density exam. You can talk with your podiatrist about your foot bone, and how that can help, or if that is adversely affecting your heart as well. So do be aware of bone health, as well as kidney health, your dental hygiene, oral hygiene health as well. So coenzyme Q10 or CoQ10, krill oil, omega fish oil products are supplemental products, but first talk with your physician to make sure that's what they want you to do. I'm Dr. Erica. Thank you for joining me. Please visit all of my other videos. Like, share, subscribe. Take care. Bye bye.